right, good morning. So we're going to talk today about what your expectations are, your interests, and what concerns you.
Okay, so I'm turning 54 in December, and I don't like these jowls.
Okay.
I want my eyes, I want to have a bigger eyelid so I can put eyeliner on more easily.
Okay.
And my neck, I want to look exactly like myself, but 20 years younger.
Well, what I'm going to do is just examine you briefly, and then we're going to talk about what the process is. So I know you've had eyelid surgery several times before.
I've had it twice.
Correct. So one of the things that we look at is trying to take out some more skin from the upper eyes so that you can put your makeup and eyeshadow a lot easier.
Yeah.
And that's what's going to be involved in the eyelid surgery. That should help with peripheral vision. It should help with more light in your eyes.
Yes.
And it will help to improve the shape of your eyelid so that you can put some more makeup on and not have it kind of stick to your eyelashes.
Exactly.
In that area, the sutures that are placed come out within 1 week.
Okay, so for the face, where are the sutures?
Right, so let's move on to the facelift surgery portion. So our plan is, because the cheek structure in your face still is really good, I don't think we need to add much more volume to the cheek area.
Okay.
The main concerns I have of trying to work on, like you said, are the jowls and the looseness of the skin of the neck.
Okay.
And so my concentration is going to be on the lower half of your face.
Okay.
The incisions for a lower facelift are along the border of your ear, right along the edge of the ear cartilage in the front of your ear. It goes around the lobule or your earlobe, and then it goes along the creases of the back of your ear.
Okay.
The incisions that are in the front of the ear heal really nicely, and those fade away very quickly. They typically involve having the sutures removed after about 1 week, and then we wait an additional week. The second week, we remove the sutures from the back of the ear. But the way you wear your hair right now, it's going to be hidden behind your hairline, and you're really not going to see very much there. In addition to that, there is a small incision under the chin area. And the reason to do that is because we have to expose the skin and the muscle of your neck. Sometimes I will put sutures, tighten the muscles in your neck as part of the procedure. And then we put a small drain in the neck area overnight, and then it gets removed. The stitches under the chin are healed beautifully. The scar is minimal, and the stitches will be removed after 1 week.
How much downtime will I have after the surgery?
Yeah, so for most patients who have a facelift procedure, lower facelift surgery really doesn't take more than about a week or two of recovery time. I'd say after about 2 weeks, you're able to go back out into the public eye. So most patients find after 2 weeks they feel comfortable going out.
And how long before I can do yoga or work out again?
Strenuous exercise, we wait a little bit longer. I generally like to wait about 3 to 4 weeks for that, and we'll make a decision of that based on the degree of swelling or bruising that you may have. But most patients develop little to no bruising or swelling that persists beyond the 2 weeks, and so it's fine to go ahead with yoga.
Can you show me like how my face will look
So what we can envision is in a lower facelift, we're trying to tighten these jowl areas here. So what you can typically expect is a feeling like that, where we create a more oval shape to your jawline and tightening of the skin. In the neck area, you can get a more tightened look, and you'll stop feeling this kind of loose skin in the middle of your neck, and you'll feel that after surgery.
I look so much younger like that.
Yes, yeah. And so after that's done, then we do the laser treatment, starting in the forehead area, extending all the way down to the jawline and chin area. And I will do your nose and your lower eyelid area on both sides. The only part is your upper eyelids, because we're going to be doing surgery in that area. We don't really do much lasering close to the incision line, but your lower eyelids are going to have the same laser treatment.
I can't wait.
Good. So in preparation for surgery, which usually starts about 2 weeks before surgery, I generally recommend that you stop any alcohol intake. In addition to that, anything that can thin your blood. Things like a vitamin E, aspirin, Advil, Aleve, anything that will thin your blood, we try to avoid 2 weeks before the procedure.
But I can still take my normal medications, right? I'm on high blood pressure.
Yes, your blood pressure medications and any other medications that you need, you definitely continue to take, including the morning of surgery. The anesthesiologist will discuss with you that the night before surgery, but you definitely want to continue your other regular medications.
And I need to stay out of the sun, correct? I have a lot of sun.
Yes,
right
so
now,
sun exposure can definitely affect the results, and so in general we try to ask our patients to avoid a lot of sun exposure that will burn your skin, because we're going to be using a special cream that will prep your skin for the laser.
And that's 2 weeks before?
And the cream begins about 2 weeks before the laser treatment.
And I think I'm ready.
Sounds good. I think you're a perfect candidate, and you're just going to love it. We just need a little time of recovery, and you're going to be really pleased with the results.
Okay, great.
Good.
Thank you.
You're welcome.